And Jeff, the last question I have for you, Zoe was talking about social distancing within the clinic, and I realized that the footprint of many of the infusion clinics can be small, and so all of a sudden you're trying to get 6 feet means there's less space, means there's less chairs, and I just wanted you to talk a little bit about what's happening with infusion capacity and how that could affect people with IBD.
Yeah, it's a great question, and the clinics across Canada, across all 4 of our companies, come in all shapes, sizes, and big, large, small, 10 chairs, 12 chairs, 2 chairs, 1 chair. And obviously 1 chair is perfectly ideal because that's the ultimate social distancing, because it's only 1 patient and the nurse. But that's not the reality in most of our infusion clinics. We need to have more than 1 chair. So in the larger clinics, it's somewhat simpler because we can basically just rearrange the layout of the clinic and the chairs in the clinic to provide the 2 arms length or 2 meter spacing. Sometimes maybe we have to remove a chair or not book patients into a chair so that we can ensure that social distancing by rearranging. But yes, in the smaller clinics, that can sometimes be challenging, or you're removing a chair to ensure social distancing, and then you're reducing your overall capacity or available space for patients to get infused. So what we all are doing is ensuring that we have social distancing in the clinics, regardless of what size it is, and then flexing the hours of operation, offering more hours on the weekends, offering more hours on the evenings or early mornings or whatever, right? So that we're able to still see the same number of patients and more patients, even though maybe we've had to cut back on a chair to ensure that we have the right amount of spacing. Zoe mentioned about vinyl screens that can be cleaned. That's also another option in smaller clinics where it's harder to get that spacing. We can install these temporary or movable screens and then wipe them down in between patients as well. And while the spacing might not be full 2 meters, there's a physical barrier between the two, essentially taking a room and dividing it into 2 with a movable screen. So these are some of the things that we're doing to encourage social distancing in the clinics, while also ensuring that there's adequate access across the network for appointments to happen.
Yeah, that's a good point. I just wanted to add as well, in terms of visitors, we've made sure that we kind of changed our policy. We used to welcome visitors, and now we have a no visitor policy except for what we would call an essential visitor. So certainly the parent of a minor child or somebody who's needed for mobility assistance could be allowed to come into the clinic. But besides that, there really are no visitors allowed. And most of our patients and families have been really understanding, understanding the need for social distancing and less people coming in. And that's another measure that we're looking at.
And yeah, that's a great point. Yeah.
I just wanted to comment that, we have experienced that patients have been amazing through this for us. And we've had to move patients a lot in the last couple of weeks as we adjusted to this and moved our capacity around and sorted out how we were going to align to social distancing or physical distancing. So, I know patients have gone through a lot, but they've been very flexible and very accommodating, which has made it easier for all of us.
Yeah, I'd echo that too, Noreen. The patients have been very flexible when things needed to shift or move around. Very understanding, very flexible in this very difficult time. Our goal is to service everybody and make sure everybody gets seen. And we do appreciate your understanding when things are shifting. Things are moving very fast, and we're moving as fast as we can to keep up with the changes.
Right, and just to add to what Jeff just said, I guess the key point here is for us not to interrupt the continuity of care. Gail and Eric both commented on how important it is for the patients to stay on their treatment, for patients to continue to come and get their infusions. We want to make sure that the environment that we are creating is safe, and at the same time safe for them and safe for our nursing staff, so that we can provide that quality of care and we can provide that uninterrupted care over a long term.
Yeah, and I just want to end by thanking all of the panelists, and just to remind everyone in the audience that we met this morning, and then we had an amazing video conference to ensure the safety and the integrity of the infusion clinics, and we're all going to be working very closely together over the weeks between Crohn's and Colitis Canada, between healthcare providers, between the infusion clinics, and reaching out to provincial health authorities as well, to ensure the integrity and the safety of infusion clinics throughout this pandemic. And again, I just want to thank everyone. You weren't expecting to be here tonight talking about infusion clinics, but I'm sure everybody who's watching this is appreciative of everything you said. Thank you so much.
Thank you, and that's what we're here for. What we do, so we're glad to help.